Okay, so the first thing which we are going to do today is going to be the peak flow. Now, the other one, as I said earlier as well, so today we will be doing peak flow and inhaler and MSU. Now, out of these two stations, peak flow and inhaler, they are like the stations where you have to educate the patient and also do the procedure as well. So I think that whenever we are going to be educating a patient, there are certain things that we'll need to make sure that we are telling the patient, and also time to time we are assessing that the patient is understanding, and they will be able to do the or use the inhaler or use the peak flow in the way that it is meant to be. So I think let us start with the peak flow first. Now, when we are starting with the peak flow, before we jump onto the scenario and I tell you that how to do the scenario, I think the main thing that we'll need to understand is that whenever we are teaching anyone anything, yeah, especially like if it is an instrument or a process or how to do it, then there are few things that we need to keep in mind. And if we keep those things in mind, or those questions, or if we go in a planned manner, then it is unlikely that you are going to be forgetting anything, and your station is going to flow very smoothly and very nicely. So the first thing whenever we are teaching anyone is, and whatever we are teaching, we need to first understand that what that thing is. Yeah, so what is our first question, that what is that thing? Then why we are using that particular instrument or that particular process. So we need to know why, we need to know what, why, and then we need to also understand the parts of that particular thing, that what all are the parts of that particular instrument, and what does each part signifies. So we need to understand the parts. Then we need to know the position. So we need to understand that in what position the patient needs to be in order to make sure that they are that is the optimum utilization of that particular instrument. Then the procedure. So actually doing the procedure, how to do it. And then in the end is the maintenance. So there are almost 6 steps which are there. And out of the steps, it is what, why, parts, position, procedure, and maintenance. So these are 6 things that if we follow these 6 things, then it is highly likely that we will not be forgetting anything, and we will do this station according to what is required. So if we take our first our first instrument, which is your peak flow. Now, the scenario is going to be something like that. The patient has recently been diagnosed with asthma, and have been started on inhalers, but have also been advised to use a peak flow and to measure his peak flow before and after the using the inhalers, and then go and see a GP in about a month's time. So this is going to be kind of a scenario, and you are going to be tasked with that. You have to teach the patient how to use the peak flow, and also you will need to take the first set of readings for the peak flow. Now, can anyone tell me that now we are going to be doing, so I want one person to do the introductory 6, so that we can start from the same sort of thing as we will be doing actually in the exam. So Anita, since you are already unmuted, so can you just do the introductory 6? So you can consider name of the patient as Ash Potter, and the date of birth is going to be 1/1/1980. So you can start.
Good afternoon, everybody.
Good afternoon.
So introductory. I'm entering my room and I'm wearing the before I enter the room, which it is. After I proceed to my hygiene, sanitize, palm to palm, palm to palm, and back to finger laced, finger locked, rotational movement of my then afterwards greet my afternoon dashboard. Anita into you throughout my please confirm your and
I think that there's some issue with your mute button. It keeps on getting unmute and mute. So do you want to just unmute yourself and see if that works?
okay, I think I'm unmuted now. Can everybody hear me?
Yeah. Yes. Now we are able to hear you properly.
Okay, so I guess I should start again from the beginning.
Yes, please. Yes, please.
So I'm entering into my patient's room and ensuring everywhere is safe. I'll greet my patient. Good afternoon, Mrs. Ash Potter. I'm Nurse Anita, and I'll be attending to you today throughout my shift. I'll proceed to carry out my hand hygiene with the hand sanitizer, and I'll start by doing my palm to palm, fingers interlaced, fingers interlocked, back of palm to back of palm, back of palm to back of palm. Okay. Rotational cleaning of my thumb.
Okay.
Left and the right thumb. Then I've done the finger interlaced, finger to tip of finger to my palm.
Yeah.
Tip of my palm, then my wrist.
Yes, the wrist.
Yeah.
So we need to be very, very thorough with this one. Yeah, you're getting a bit confused. Okay, fine. Yeah. Carry on.
Okay, so I'll good afternoon, Mrs. Ash Potter. I'm Nurse
Good
Anita.
afternoon.
I'll be attending to you today throughout my shift. Okay, please, I would like to confirm your name with what is written on with what I have on your chart. So please, could you tell me your name, Mrs. Ash Potter?
My name is Ash Potter.
So, okay, thank you. Your date of birth, please.
It is 1/1/1980.
Okay, so that's correct. That's what I have on your chart. Will you mind me addressing you as Ash?
No, that's fine.
Okay, thank you very much, Mrs. Ash Potter. So I would like to ask, do you have any allergy?
No, I'm not allergic to anything. Okay,
that's good because I can see you have your white wristband on your wrist. So that shows you're not allergic to anything. Okay, so I'll be carrying out, I'm here to put you through on a procedure, which is the use of the peak, how to measure your peak flow rate and also the use of an inhaler. Would you mind if I proceed with that?
No, that's fine.
Okay, thank you. Now I have your consent, so I guess I can proceed with that.
Okay.
Okay.
Okay, so thank you. So yes, you did pretty well. And I think with a little bit more practice, it is going to become perfect. So just carry on practicing. So as we have been able to see that it is going to be that, okay, you are going to go in, you are going to make sure that you have confirmed that the room is safe for you to enter, you do your hand hygiene, you are going to introduce yourself, you are going to be taking the checking the patient ID and making sure that you are with the correct patient. Then you do the patient allergy checking. And after that, you are going to be setting up your purpose. Once you have set up your purpose, then you are going to be going ahead and you are going to introduce your procedure and the instrument that you are going to be using. So as we have already said that the first thing that we are going to be doing is going to be peak flow. Now, I'm going to be showing you the peak flow. So this is what a peak flow look like. So I'm going to be telling the patient that I'm here today to teach you about the peak flow. And this is how a peak flow is going to look like. Have you ever seen a peak flow before or used one before? And the patient will say, if yes or no, whatever the patient says, it does not matter because you are anyway going to be showing the patient and telling the patient that what a peak flow is. So for the first thing about the what and why, the two questions we are going to answer first. So you are going to say that this is an instrument, and this instrument is called as the peak flow. And the reason why we use this instrument or a peak flow is to measure your lung capacity and also to make sure that your inhalers are working. So these are the two purposes that you have got. One, to measure the lung capacity, and second, to know whether the inhalers are working. Now, both of these things are although interrelated, because you know that if the inhalers or if the peak flow or lung capacity is high, then that means that the inhalers are working, because the more congested your lungs are, the less your peak flow is going to be. So the more your peak flow is, that means that your lungs are not congested and that your lung capacity is more and you are able to breathe better, and that you are not having any problems related with asthma, or your asthma is under control. So these are the two, we have set our purpose, and we know that what is peak flow and why we are using the peak flow. Now we come to the third part of it, that what are the parts of the peak flow. So we will tell the patient that the peak flow has different parts. So there is this is a mouthpiece, that the mouthpiece of the peak flow, it is a detachable one, and it can come in two forms. It can be either a plastic one, which is this, which I'm having, and or it can come like a cardboard one, which is a disposable one. So if the peak flow meter is being used in the hospital or a clinic where it is used for everyone, then you are going to be using a disposable mouthpiece so that you can use and throw. But if it is only for the patient's use, then you can give a plastic mouthpiece to the patient so that the patient can wash it and they can use it each time. Then there is a slot, which is this red colored slot, in which you can see that this is the slot where you are going to be inserting your mouthpiece. Then there is a body of the peak flow. This is the body of the peak flow, and in the body of the peak flow, you can see that there is this red colored plunger and this white color, the yellow color scale. So the scale is the one where all of the readings are, which you are going to be noting down when you, as your lung capacity. And the plunger is the one which will move and point to one of the readings, which is going to be indicating your lung capacity. So the plunger, the scale, and in the end, there are these holes, which are like the vents. So you are going to be blowing the air from the mouthpiece, and the air goes out from these holes. But while doing that, with force, it is going to push the plunger out, and the plunger is going to be indicating a certain reading. So you'll see that it is a very simple device. It is not complicated at all. But what it is trying to tell you is that about that how much air can you take into your lungs, because when that is the air which is there in your lung, you push it out forcefully through the mouthpiece, and that force and that air which comes out is going to give you the reading of your lung capacity. So have all of you understood that what this instrument is, why we are using it, and the parts of this instrument?
Yes.
Yes.
Okay. So now we are going to come to the next question, which is the position. So that what is the best position to use a peak flow meter? So the best position to use the peak flow meter is that you should be sitting or standing in an upright position, and your neck should be neutral. So your neck should not be bending or extending. So it should be in a neutral position, so that we have got the upright position gives our lungs the full sort of chance to be inflated and for you to take as much air as possible inside. So once you have gained this position, then you are also going to be making sure that your plunger, before you are going to be measuring, it is on 0, and that you are also holding your peak flow in such a way that you are not blocking the plunger. So you hold it in this way so that my fingers are not blocking the plunger, and then I'm going to be keeping it in a horizontal position. Now, horizontal position, because I do not want it because of the gravity that it goes down, or the gravity is having any effect. So I'll keep it in a horizontal position parallel to the floor. So once I have got this position, then I come to the procedure. So the procedure is going to be that I will require to take a deep breath in and fill my lungs with as much air as possible. And once I have done that, I will need to make a tight grip around the mouthpiece, making sure that my tongue is not blocking the mouthpiece in any ways. And then I'm going to give a sharp huff and blow out all of the air which is there in my lungs. Yeah, so it's going to be as if that you are going to be taking a deep breath in, making a tight grip, and then giving a sharp huff like that. The idea is to push the plunger as far as possible. So once you have done that, and then you will note your first reading. In the exam, because all of the skills are done on mannequins, so you are not, obviously the mannequin is not going to blow out from this one, from the mouthpiece, or they will not be able to give you a sharp huff. You are only going to be pretending and saying the same thing. But as soon as you have done this, the examiner is going to give you your first reading. So once you get your first reading, you make a note of that reading on a piece of paper that will be provided to you on the exam. After that, you are going to bring it back, the plunger back to 0, and you will ask the patient that we are now going to repeat it 2 more times. So in total, you will require to do it 3 times, unless the difference between 2 readings, any 2 readings, is more than 40 units. So say, for example, our first reading is 380. So we have noted down the first reading. We are going to then do the second, the huff, the same manner as we did the first one, taking a deep breath in, making a tight seal around the mouthpiece, and then giving a sharp huff, and then the noting down the second reading. So second reading, I would say, is 400. Yeah, and then I bring the plunger back to 0 and I do the third reading. So when I did the third reading comes as 370. So I know that my 3 readings which I have got, it is the lowest is 370 and the highest is 400, and the difference is not more than 40. So out of these 3 readings that I have got, I am going to be taking the highest reading as my final reading. So 400 out of these 3 is going to be my final lung capacity. Have all of you understood that?
Yes, ma'am.
So once I have got my, so once I have got my final lung capacity, then I will need to, so this lung capacity which I have got, now I need to know that whether the lung capacity which I have got, that whether it is normal or it is not normal. Now, in order to find out that whether this lung capacity is normal or not normal, I will need to know what is normal. Yeah. And in order to find out what is normal, we have a chart called as a PEFR chart, or a peak flow expiratory rate flow chart. And in that chart, it will tell that what is the expected or the normal reading for a person. And this chart is dependent upon 3 things, which is going to be the gender of the patient. So for male and female, there is a different set of readings which is there. Then the age of the patient, because you will know that the younger you are, the better the lung capacity, or maybe you can say that the adult, when you are around your 20s to 30s, your lung capacity is going to be the maximum. As you grow old, your lung capacity is going to go down and down, even normal lung capacity. And then the third thing is your height. So height is something, again, it is very important, because the taller you are, the bigger your lungs are, and hence you will have the bigger lung capacity. So these are the 3 things on which your peak flow chart is dependent upon. So you will need to know the age, the height, and the gender of your patient in order to figure out what is the normal lung capacity of that patient. Now I'm just going to be sharing my screen to show you that what the chart looks like. And then we can understand and we can figure out that what should be the reading for Ash Potter. So if you just bear with me a minute. Okay, can you see the chart?
Yes, ma'am.
So as you can see, this is the chart which is there, and you will be able to see that there are these colored lines which are there. And in the colored line, you can see that it is a set of line for a male person, and there is a set of line for females. And on the side, there is height, which is corresponding to the color of the line. Yeah, so you can see the red line will follow the 190 centimeters. The green line is for 183 centimeters. The blue line is for 175, and so on and so forth. Yeah, and there is on the x-axis they have plotted the age which is there, and then there are on the y-axis you can see that there are the peak flow readings. So these are the normal peak flow reading. So this is the chart that you will be using in order to figure out that what is the normal for my patient, and then you are going to be picture it according to the reading that you have got, that whether this reading is normal or whether it is low for this patient. So now we know that we did the reading for Ash Potter, and the reading, our highest reading came out to be as 400. Now I'm saying that Ash Potter is, say we are considering Ash Potter to be a female, yeah, and I would say that her age is say around 40 years, yeah, and her height is 160 centimeters. Now, can anyone tell me that what should be her normal peak flow looking at the chart? So it's a female patient. The height is 160 centimeters and the age is 40 years.
430. 320. 430. Sorry, yeah.
Yeah, so I think that you have figured out that it is not 320. 320 is if she was 85-year-old. Yeah.
Mm-hmm. Yeah.
Yeah. So, but she is 40 years old.
Mm-hmm.
So you have to see that the 40 years old, and you follow this pink line of 160. So you follow it up over here and go on top where the line meets, and then you are going to draw a straight line to figure out that where it is corresponding on the peak flow values. So you see that it is 430 is the one, yeah, which is coming for this patient, and our reading which we have got is 400. So that means that the patient's peak flow is less than what it is going to be required for anyone who it is slightly lesser than a normal peak flow reading. So for anyone who is not suffering with asthma, for them and if they are of the same height, same age and gender, their peak flow should be around 430, but your patient peak flow is 400. So you are going to be now discussing with the patient, and you are going to tell the patient that this is what your peak flow is and this is what it should have been. But you are also going to reassure the patient that it is fine, there is nothing to get worried about. You have already been started on the inhalers. So hopefully with the time and with the usage of inhalers, your lung capacity is going to get better and better, and you are going to get very near to the normal readings. So, yeah.
Do we need to do any charting in this PF chart?
No, there is no charting that you have to do in this one. As I said, this is only to figure out what should be the normal for the patient. The only charting that you will have to do in this station is that you will need to write all your 3 readings which you are given, and you will have to say which is your final reading. So the highest reading out of the 3 is going to be your final reading. Okay, so that is the only thing that you will have to record, and you will have to make sure that you record it and you circle it or highlight which is your highest reading or which is your final reading. Okay. So after that, it is so once you have told the patient, you have reassured the patient. So now the next step which we are going to do is the maintenance. So we have done the what, why, parts, positions, procedure. Now we come to the last one, which is our maintenance. Now for the maintenance of this device, you are going to tell the patient that you will have to just make sure that you clean the mouthpiece before and after every use. You can just use a simple soap solution and let it drip dry. That should be more than enough. And in about 1 month time, you will need to clean this your body of the peak flow as well by dipping it and by into the soap solution and just rinsing it out and leave it to drip dry. So no need to wipe it or no need to scrub it or anything like that, because you might spoil the plunger and the readings and all that sort of thing. So that is more than enough. If at any time, if you feel that your the plunger is getting very, very loose, or if there is any damage to your peak flow, you can always get your GP to write you a new prescription, and they should be able to, you should be able to get a new peak flow meter. Also, it is important advice that you need to give to the patient is that this peak flow meter with the reusable mouthpiece is only for the patient's use, and that they should not be sharing the mouthpieces. So this is the what all is going to entail in your peak flow meter sort of this in this station, doing the peak flow and measuring the peak flow and interpreting the peak flow. Now there is one question that we need to also answer. I said that you have to do 3 readings of this one and make sure that there should not be a difference of more than 40 between any 2 readings. Now, what will we do if there is a difference of more than 40 in any 2 readings? What should we do?
Then I think if it's more than 40, I think we will do 2 more readings.
Yeah.
Absolutely. So if the difference is more than 40, you are going to do 2 more readings. So instead of taking the best out of 3, you are going to take best out of 5. Okay, so is that clear to everyone? Any question anyone has in the peak flow? No question?
No, ma'am.
Okay, well, that's good. So then we are going to be moving on to the next one, which is going to be our inhalers. Yeah, so the inhalers are, so I'm sure that everyone knows about the inhaler. Everyone would have seen the inhalers. Yeah. Any question anyone has before we start on the inhalers? No? Okay, then that's good. So in the inhaler station, so along with the all the things that we have already discussed for the peak flow, so we will need to do the that what and why, and the parts, the position, the procedure, and the maintenance. Along with these 6 things, there is one more thing which is very, very important in the inhalers. Now remember, inhalers are also a medicine. So you are giving the medicine through the inhaled route. So what are the principles that we will need to follow?
We'll have to check the 5 rights of drug administration.
Yes, we will need to find the 5 rights of the drug administration. Yeah, so that is the most important thing, that we are going to be checking the 5 rights as well. Yeah, so it is very, very important that we follow that one. So it is almost becomes like that you are teaching this station, as well as there is a implementation part to this station as well. Yeah, so now we will start one by one. So we will start by the teaching on this one, and I'm skipping the introductory 6 because we have already done that. We have gone through that one. So we are just going to start with that what is an inhaler. So who is going to tell me the what and the why of the inhaler? Neha, do you want to tell me that what is an inhaler and why do we use the inhaler?
Inhaler is the one kind of device which is used to administer medicine in inhaled route.
Mm-hmm.
And like for example, what we call
Salbutamol.
Yeah, salbutamol is one of the example of medicine which is used in inhaled route.
Yeah.
Yeah.
So you are right that the inhaler, it is a device which is going to help us dispense the medication in an inhaled route. So sometimes the way that the medicine is given also is important, because that is the best way for that medicine to be absorbed. And that is why sometimes you give it in an inhaled route, sometimes you give it as an injectable route, sometimes you give it as an oral, sometimes you give it as a patch, sometimes you give it as a spray. So there are various sort of ways and routes that you give the medicine. So the inhaled route is the one where you are giving the medicine through by an inhaled route using a device or an instrument called as an inhaler. So along with the inhaler, the task is going to be the inhaled medication using a spacer. So that is another device which is also there, a spacer. So can anyone tell me that what is a spacer and why do you use the spacer? Jessamy, do you want to tell me?
Yes, ma'am. Spacer is using for getting more usable for the patient, because it is helping for the patient to hold the inhaler, and it is helping for the patient to aspirate the full content of the medication.
Yeah, so the spacer, it is a device that sometime what happens is that sometime you are able to give the medication through the inhaler route, but the medicine is itself, the patient is in not such a state that they are not able to take the medicine properly through the inhaled route. So what happens is that they are trying, but they are not able to utilize, or it is not able to take a maximum utilization of that. So sometime, in order to make it easy for the patient, you give another device which is called as the spacer. Now imagine that if it is a small child or if it is a very elderly person, sometime those are the people who will find difficulty in coordinating the breath as well as using the inhaler at the same time. So you are going to be using a spacer in which the medicine is held while the patient is actually taking the medicine, and it becomes slightly better a way of giving the medicine to them. Now, when we are using a spacer, we use a technique called as a multi-breath technique. If we are using directly from the inhaler, it is called as a single breath technique. And if we are using the spacer, we call it as a multi-breath technique. Because in the spacer, we do not, the same amount of medicine that we are taking, we take it in 5 breaths, which we will be taking in a single breath if we are using it directly from the inhaler. So if I show you, so this is basically what an inhaler looks like. So depending upon what is the type of inhaler, it can come in different colors. So the blue inhaler is normally the inhaler which is which contains salbutamol medicine, and the brown is the one which is used for beclomethasone, which is a steroid inhaler. Yeah. So in your exam, you are going to get a salbutamol inhaler. Now, Priya, can you tell me that what exactly is salbutamol? What does it do?
Ma'am, salbutamol is the bronchodilator which helps to clear the airway and makes the respiration more smoother and easier.
Absolutely. So well done. So salbutamol inhaler is also called as a reliever inhaler. And the reason that why it is called the reliever is that because it relieves the acute attack of asthma. So, and that happens because the medicine that you are using is a bronchodilator, which as soon as you take it, it dilates or opens up your airways, and that is why you get relief from the asthma. So that is why we use the bronchodilators, salbutamol. So now we know that what is an inhaler. We know why we use the inhaler. Now the third thing which we come is the parts of the inhaler. Now in the part of the inhaler, you will see that this is the mouthpiece. Usually there is a lid as well, which will be covering it, the mouthpiece, but this is the mouthpiece and this is the body of the inhaler. And in the body of the inhaler, you will find the medicine canister. So this is basically what a medicine canister look like. Now, when you are in the exam, when you are checking the medicine canister, it is better that you are going to be checking your chart at the same time. So in your drug chart, you will be, along with the station, you are also going to get a drug chart, and in that it will be written that what is it is just like an implementation chart. So it is going to tell you that this is all the R's of the medicine. So you will be reading that the medicine is salbutamol. It is 100 microgram in 1 puff. The dose is 2 puffs. The route is inhaled route. The duration is for ongoing, and the frequency is QDS, 4 times a day. And they are going to be giving the time, the doctor's signature, and prescription and bleep number is written. Start date and finish date is also written. So all your R's are correct. And you are going to be checking that, yes, the medicine, it contains 100 microgram in 1 puff. And my dose is to give 200 microgram or 2 puffs that I will be giving. And also I can check that it is within expiry and it is safe for me to use it. So at the same time, when you are checking the canister, you have also checked that your 5 R's are there of the medicine. So you have got, now these are all of your parts. So the mouthpiece, the body, and inside the body there is a canister. So these are the parts of your inhaler. Then you are going to look at the spacer. So this is how a spacer will look like. So the spacer has a mouthpiece. This is a mouthpiece of the spacer, which is covered with a lid. Then this is the body of the spacer. Now the mouthpiece, and between the mouthpiece and the body, you will see that this part, this is like a valve. So over here, this valve is going to control that how you are taking the medicine. So it is a one-way valve so that you can take the medicine out, but your breath when you are exhaling is not going to go inside this one. It will come out through the vents over here. So it becomes easy that without diluting, you are taking the medicine out from this one. And the medicine is going to be stored in this chamber till you have actually taken the medicine. And in the end, there is a slot where you are going to be putting your inhaler. So it is going to be slotting like that. So this is how your inhaler and your spacer is going to look like. So it's clear to everyone? Is it clear so far?
Yes.
So now we have done the parts. Now coming to the position. So the position for you to take the inhaler is also going to be the same as what we did for peak flow. So we are going to sit or stand in an upright position and making sure that the neck is on the neutral position. Yeah. So once we have done that, before we are, then we come to the procedure. Now in the procedure, we have already checked that it is the 5 R's of the medication. Now, before we give the medicine to the patient, what is the other thing that you will need to check? Anyone?
Okay, I think you have to check if patient is not coughing.
Okay, that is fine.
Or if patient is not choking with anything, if airway is clear.
Yeah, that is okay.
Uh,
But you are also going to be checking the second ID of the patient. The second ID check for the patient. Remember, it's a medicine. So before giving the medicine, you will do the second ID check of the patient. So you are going to check the name and date of birth of the patient. Once you have confirmed that, then you are going to be shaking the inhaler. So you will shake the inhaler for 2 to 5 seconds. Once you have shaken, you are going to be inserting it inside the spacer. You will check with the patient that I can see that you are sitting in an upright position and your position is fine. Now you will tell the patient that the patient will need to take a deep breath out or exhale. Yeah. So patient is going to take a deep breath out, make a tight grip around the mouthpiece, and the patient will need to take 5 breaths out of this medicine after you have pressed the canister. So you are going to be pressing the canister. Yeah. And you are going to count that the patient has taken 5 breaths. So you'll count 1, 2, 3, 4, 5. Once the patient have taken the 5 breaths, you are going to take this out, ask the patient to close their mouth. you are going to wait for 30 to 60 seconds between two puffs of the same medicine. So you are going to wait for some time, around 30 seconds. You are going to take your inhaler out again. And again, you are going to shake it for 2 to 5 seconds. Then you are going to be inserting it and repeating the same procedure again. You will check that the patient is still sitting in an upright position, in the neck in the neutral position. You will ask the patient to take a deep breath out and make a tight grip, and you are going to press the canister one more time, and the patient is going to take 5 more breaths. So once you have done that, the 5 breaths for the second time, then you are going to tell the patient that, okay, I have given you the medication as per my drug chart. So you have taken 2 puffs of salbutamol inhalers, and you are going to be signing the chart. So once you have done that, then you are going to be telling the patient, so that I have given you the medication, and maybe sometime you can feel a little bit flushed because of the side effect of the medicine, or you might feel that your heart rate is increased or your heart is racing, but it should settle down very quickly. Then once you have told that, you are also going to tell the patient that now we are just briefly going to discuss about the maintenance of this device. So if you are using directly from the inhaler, then make sure that you clean the mouthpiece before and after use. You can just use the cleaning wipes and let it dry for 30 seconds. And the spacer, you are going to be using the spacer by the mouthpiece. You will clean before and after every use. And once after every 30 use, you are going to rinse the spacer by using either a soap solution or a sterilizing solution. So either of them, and let it to drip dry. Again, please do not, you do not need to scrub it, or you do not need to wipe it from inside or use a brush or something to clean it. Because if you are going to be using any harsh material, then it might scratch the surface, and the medicine then can get stuck on the surface, and you might not be able to take the proper medication when you are using this. Okay. Another important thing, that to make sure that you tell the patient that they should not share the inhalers or the spacer. It is for their own use, and that they should be aware of the expiry date, as well as that they should have a spare inhalers just in case if you run out of the medication. So once you have done that, then that completes your station. You can ask the patient that if there is any question they have. If there are no questions, then you can just thank the patient, clean your or do your final hand hygiene, and you can leave the station. So any question any one of you have? No? Okay, that's fine. So that's good. So now we are coming to the third station, and the third skill which we are going to be doing today, and that is the MSU. Now MSU is the midstream urine specimen. So can anyone tell me that how are you going to be collecting a midstream urine specimen? So maybe before that, we can say that in the MSU station, there are kind of 2 parts for it. It is not actually divided, but you in your mind can divide it into 2 parts. The first part is that when you are giving instruction to the patient of how to take a midstream urine specimen. And the second part is that when you are actually doing the test and interpreting the results. So if we are going to be thinking of the first part, then we have to tell the patient that you have to go and collect the urine specimen. So how are we going to describe that? How does the patient need to collect the urine specimen? Prince, can you please tell me?
Okay, so what should I start from, Dr. Seema?
So you can just start by explaining the procedure, explaining to the patient that how do they need to go and collect the urine specimen.
Oh, okay. So I'll start by explaining to patients how a patient has been showing signs of confusion, increase in temperature, and so there's a need or a reason why the doctor has prescribed for patients' urine to be taken for investigation.
Yes.
Then I'll tell patients, I'll make sure that patient's bladder should be full.
Okay.
And also, I will also teach patients on how to make genital parts clean so that urine is not infected when a patient is urinating. And also, I will show patients the urine sample bottle and explain or show patients the required sample that we need, not to make the urine too full to fill the container, but probably half filled.
What instruction are you going to give to the patient to when you will say that to clean her genitalia before the collection of the urine specimen? Okay. Anyone else? Christine,
Can I help?
Shama? Yeah, of course. Go ahead. Anita,
Okay,
you can go ahead.
Okay, continuing from where he stopped, the instruction I'll give the patient regarding the cleaning of her genitalia is when she wants to clean her genitalia, she should clean from front, like from the front part of her genitalia to the back and not from the back to the front. So she doesn't introduce microorganisms from the anal part to
Absolutely.
Yes.
Yeah. So whenever this is a principle that whenever we are going to do any kind of cleaning, we always clean from the clean to dirty side. Yeah, so that we are never going to be doing cleaning from the dirty to cleaner side, because that is making the cleaner side more dirty. So you are always going to clean it from clean to dirty side. Yeah. So make sure that you are instructing the patient that when you are going to be collecting your urine specimen, as you said, Prince, that they need to make sure that their bladder is full. They will need to go to the toilet and make sure that they clean the genital area using soap and water. And when drying and cleaning, then they have to make sure that they clean it from front to back, or that is from front to back is the from clean to dirty side. Once they have cleaned, then you will need to start voiding the urine or passing the urine, and you will need to make sure that you are keeping the bottle or the container ready to catch the middle portion of the urine. So you keep the container ready, making sure that you are not touching the rim or you are not contaminating the lid. So you can just keep the lid on one side and you will start passing the urine. So let the first few ml, few mils of the urine go into the toilet, and then catch the middle portion of the toilet and just fill at least around 3/4 of this container. Once they have done that, then they can pass the rest of the urine into the toilet, and just making sure that again we are not touching the rim. We are going to be closing the container, and this urine is now a midstream urine specimen which is ready to be checked. So you are going to be telling all of these steps to the patient, and you are then going to ask the patient that once you have collected the urine, please come back, and I'll in the meantime I will go and collect my articles. Okay, is that clear to everyone that what instruction you are going to be giving to the patient?
Yes, ma'am.
Dr. Seema,
Yes.
what of a male patient? Because I think this is for a female patient. So what if, let's say you have a male patient?
So in the male patient as well. So in the male patient, we will be telling to clean the glans of the penis, making sure that the foreskin is taken back a little bit. And then you are going to be cleaning from inside to out, so that to make the meatal part should be more cleaner than the outside of that one. And then again, the same procedure that you are going to pass the first few ml in the urine in the toilet and collect the middle portion and let the rest of the urine void.
Okay, thank you.
So in the exam, although they always keep a female patient.
Okay.
And that is why we were discussing more about the female patient. But yeah, this is how, if it is a male, then these are the instructions that you will be giving.
Okay.
Okay, so now that we have told the patient that, okay, they can just go and collect the articles. Now, the other thing that we will, to collect the articles, now what we need to do to collect the articles. So now I'm going to be telling one sequence to all of you, and this is the sequence that we are going to be using to collect the articles in all of, in whichever skill stations that we are going to be required to collect the articles. Yeah. So this is just the same sequence that you will need to follow. So the first thing that when we go to collect the articles is going to do that you are going to do your hand hygiene. And you are going to be checking while doing the hand hygiene. You can always check with your examiner that examiner, is my tray in which you are going to be keeping all of your articles, that is my tray cleaned with soap solution in the last 24 hours. If it the examiner is going to tell you that yes, it is cleaned with soap solution in the last 24 hours. After that, you are going to be putting gloves and apron. And you are going to say that, okay, now I'm going to be cleaning it with the alcohol wipes. So you are going to pick up an alcohol wipes and you are going to check with the alcohol wipe that whether they are in date and they are intact. So once you have collected that they are in date and they are intact, then you are going to take out one wipe and you are going to be cleaning the tray from inside out for 30 seconds and let it to dry for 30 seconds. Then you are going to take off your gloves and apron and you are going to do your hand hygiene again. So this is the sequence that you have to follow, that you are going to clean your hands, wear gloves and apron, make sure that the tray is cleaned with soap solution. After that, you are going to take alcohol wipes, check that alcohol wipes are intact and in date, take out one wipe, clean the tray from inside out for 30 seconds, let it dry for 30 seconds, and then take off your gloves and apron and clean your hands again. Has everyone understood this? Everyone clear with this sequence?
Yes, ma'am.
Okay. So after you have done that, then you are going to be start collecting all your articles. Then in this one, so what all articles will be required to test our urine? The first thing that we are going to be requiring is the heuristics. So the bottle of heuristics we will require. These are the ones which you are going to be using. So if you check this bottle, so if as a name, so it is all upside down, but you can see that the name, it says 8SG or 8X. So that means that it is going to be checking 8 parameters or 8 things that it can check. Yeah. And all of these 8 are going to be marked on the side. So when you are going to be checking, you will check against the color. So I'm sure that all of you would have already done it, but it is what's going to happen is that the first line, which is going to be over there, first line is like a normal, that this is how the normally, if you are going to be dipping the heuristic in the urine, which does not have any infection, this is going to be the color of all of the strip. But if there is any sign suggestive of infection, and that means that either there is any presence of glucose or presence of protein, presence of nitrites, presence of blood or anything of that sort, then that is going to change the color of that particular box. And depending upon what the color is, you are going to tell that how much is the presence of it. Like say, if you are doing for glucose, if there is only a trace amount of glucose, then the color is only going to change slightly. But if there is a lot of glucose which is present in your urine, it is going to turn very dark. So like if you see this one, I don't know whether you can see this one or not. So this is like for the glucose. So if you can see, the normal is like green. But if there is a lot of glucose over there, it is going to turn almost brown. Yeah, so this will tell the intensity of how much of the glucose is present over there. Then this is like ketones. So if there is no ketones, then it is going to be almost like pinkish. But the higher the ketones, it is almost going to turn purplish or dark maroon. Yeah. So you are going to be reading, you are going to be dipping your heuristics in the urine, and then you are going to be reading against all these boxes, and you are going to be finding out that how much of that particular thing is present in the urine and whether it suggests that there is a urine infection or not. Now, in order for you to now read all these things, there is an optimal time at which time you should read. And that depends upon, like, once you have dipped the heuristics into the urine, and you take out, you check that what time did you dip it in. And after that, you count the seconds. And as per the seconds, you are going to be checking that at what time you should be checking for what parameter. For example, if you are checking glucose you will check as the first one, which is going to be at 30 seconds. Ketones, you will check at 40 seconds. Specific gravity, you will be checking at the 45th second. And then the blood, protein, nitrites, and pH. These 4 things you will be checking at 60 seconds. And at 120 or 90 seconds, you will be checking the leukocytes. So these are the 8 things that you are going to be checking. And as you carry on checking, you are going to be marking that, okay, what is the reading that you have got? Now, have all of you understood this thing? It's slightly tricky, but have you understood the principles that how we are going to be checking it?
Yes.
Yeah. So you do not need to, although you do not need to mug up the timings, because the timings will already be indicated on the bottle. So over here, they will already say what time it is going to be there. So these bits which are there over here, it is going to say that at what time you have to read what readings is going to be there. So we are going to be, the first thing that we will put in our tray is going to be the bottle of heuristics. Like everything, we are going to check that it is intact and it is within expiry. After that, we are going to open the bottle, and we will also check inside to see that all of the heuristics are facing the right way up. Yeah. Once we know that all of them are facing the right way up, we are then going to say that, okay, it is fine for me to use. And then you are going to be putting it into your tray. Now, what is the other thing that you are going to be using? So we will take gloves and apron, and we are also going to be taking some tissue paper. And we will take a recording paper in which we will need to record our findings. So these are all of the things that you are going to require. So once you have collected all of these articles, you are going to go at the patient side. You will see that the examiner has already kept a bottle over there, which is filled with some liquid. In the exam, it is not the urine that you are getting. It is just going to be some water with some glucose or some other things which they have mixed with that one. So you will get positive readings, but it is not going to be a urine specimen. So the first thing, that when you are going to get a urine specimen, so you are going to clean your hands, you will wear your gloves and apron. And after that, you are going to be picking up the urine bottle, and you are going to first of all check the physical appearance of the urine. So you will say that it is looking, whatever the color is. So normal color is pale yellow color or straw colored. So you will mention that I can see that it is pale yellow or straw colored. It is clear. So you are going to tell the clarity that it is clear. There is no turbidity. There is no signs of any contamination in this one. After that, you are going to be opening the bottle, and you are going to be just, when you open, you can just sniff. You can say that it is smelling normal. Sometime, because if there is a presence of ketones or something, it can smell very fruity. Once you have done that, then you are going to open it and keep it, and you are going to be taking out one strip of the heuristics. You will take that one out, making sure that you are only touching the top part of it, that one, and you will close this one back. And then you are going to be dipping it into the bottle, making sure that all of the boxes are dipped in the urine. And then while coming out, you are going to drain the excess urine, and you are just going to put it on the tissue paper. So imagine this is a tissue paper. You are going to be putting it on the tissue paper for the excess urine to be drained into that. And at the same time, you will check the time, that at what time did you do that. So once your 30 seconds are over, so then you are going to be telling the examiner that now I'm going to start reading at 30 seconds. So at 30 seconds, I'm going to be reading the glucose. So you are going to be measuring with the heuristics, you are going to be checking that your glucose. At 40 seconds, you will check the ketones. And at 45 seconds, you are going to be checking the specific gravity. Now, after 45 seconds, I know that the next thing which I have to read is at 60 seconds. So I will take this time to mark on my chart. Otherwise, I will forget that what was the readings. So I will mark these 3 things on my chart. I'll pick up the bottle again, and then I'm going to be checking the next 4 things. Now we know that all of those 4 things you will not be able to read immediately at 60 seconds. So it's fine if you are able to read them between 60 to 70 seconds, but you will say that at 60 seconds, I'm going to be reading for blood, the proteins, the pH, and the nitrites. And you know that after 60 seconds, the next reading that you have to take it as 90 seconds. So you have got 30 seconds in between. So in that much time, I'm going to be marking it on my chart again. And then I'm going to be checking my last reading, which is the leukocytes. So once I have marked my last reading, then I'm just going to discard this one. And I am going to be taking off my gloves and apron, cleaning my hands. And I'm going to then talk to the patient. I'll tell the patient that I have done your readings, and according to your readings, say for example, there is glucose which is there. So you will tell the patient that I can see that there is some glucose which is present in your urine, which might suggest that you might be having a urine infection. But you can also check with the patient that are you by any chance diabetic? If the patient says that yes, I'm diabetic, then glucose in the urine can be a finding because of the diabetes. But that does not obviously rule out that there is no infection. So if the patient says that no, I'm not diabetic, then you can say that, okay, anyway, we are going to be sending it for the lab check. Once it comes back, then maybe, and your urine infection symptoms are better, then you can get it checked again at your GP to see that whether the glucose is still present in your urine. If it is still present, then you might need to do a blood test to check whether you are getting any symptoms or signs suggestive of diabetes. Yeah. Then you will tell the patient that now I'm going to be sending off this specimen to the lab, making sure that I send it immediately. If I'm not able to send it immediately, I'm going to be keeping it in the fridge for the next 4 hours. And even then, if I'm not able to send it, then I might have to, I will need to take a fresh specimen. So this is going to be completing this station. And you will also say at the end of the station that I'm now going to make sure that I take away all of my articles. I'm going to discard the things appropriately. I'm going to be storing my heuristics in a safe place. I'm going to make sure that I clean my tray with soap and water and make it ready for the next use. And I'm going to be updating the patient's chart and let the GP know as well. And then you are going to do your final hand hygiene and you're going to leave. Now, any questions in this one? No questions? Clear to everyone?
Yeah.
Okay, well, that's great. So that completes our all 3 stations for today. And I will be, I think that I'm not sure that were you able to see the recording of yesterday's class on the YouTube? It is there. If you were not able to see it yesterday, please, you can watch it today. And today's class is also on the YouTube. So if you want to watch it again, and if you want to practice, you can do that as well. There isn't anything else that I will need to share for this one because it was more of a skill sort of thing. There is no charts or anything. But if you want, I can share the peak flow chart so that you can have a look at that chart and you can try and sort of make up just your own readings and then try and figure out that what should be the normal for that particular person. So in that way, you will get some more practice to read that chart and read the chart quickly.
Okay.
Yeah, so then I think that tomorrow we are going to be doing the next bit of our skills. So what all are we doing tomorrow? I think tomorrow is going to be our last session for this. So let me just check. Can anyone check and tell me that what are we supposed to do? Is it the NG tube and the VIP score and the Bradens? I think these are the three that we are going to be doing tomorrow.
Yeah.
Yeah, so for these ones, so again, there is the video should be there on your portal, so you can see all of the videos on that portal. So tomorrow actually we are doing 4. So we are doing fluid balance, the VIP, NG tube, and the Bradens. So so we'll do all of them tomorrow, and then that is going to cover up your API and 7 skills. So I think that these are some of the skills that we can cover without much of the instrument required. That's why we always keep in our the online sessions. But these will obviously tell you that how what are the basic principles of approaching any of the skills or the API stations. And now majority of the things that you have done over here, they are going to be same for the rest of the skills as well. Yeah, so please watch and practice the introductory 6, hand hygiene, the sequence that we just discussed about cleaning of the tray and collecting your articles. So please make sure that you do that. Read about the inhalers and the peak flow and practice saying these things, because you do not actually require anything to do this task. So peak flow and inhaler, you can almost master it just as an online thing. So please do that so that at least your 2-3 stations are out. You do not have to practice as much when you are coming for face-to-face, and you can focus more on the others. Fluid balance and Bradens are anyway going to be the written stations. So these are just the silent stations. So there isn't much that you will require to do on those ones. So, but we'll give you plenty of scenarios for you to practice. So that should be fine. Now, if there are no more questions, then we can call it a day for today.
Okay.
Yes, ma'am. Thank you.
Okay, so thank you again. And I'll see you guys tomorrow. Okay, have a nice day.